Public health officials across the United States are intensifying their warnings regarding the transmission of hantaviruses, a family of viruses primarily spread by rodents that can lead to severe, and often fatal, respiratory or hemorrhagic conditions in humans. The focus of recent reporting centers on a critical, often overlooked detail in domestic hygiene, the method by which a home is cleaned. While standard household maintenance usually involves dusting or sweeping, these common actions can become life-threatening if the environment has been contaminated by infected rodents. The core concern for epidemiologists is the aerosolization of viral particles. When dried droppings, urine, or nesting materials of carrier species, most notably the deer mouse in North America, are disturbed by a dry cloth, broom, or vacuum, the virus is lofted into the air. Once airborne, these microscopic particles can be inhaled by anyone in the vicinity, bypassing the physical barriers of the home and entering the deep tissues of the lungs. This specific mechanism of transmission explains why seemingly routine spring cleaning in rural or suburban settings can result in sudden clusters of illness. In the United States, the most prevalent form of the disease is Hantavirus Pulmonary Syndrome, or HPS, a condition that begins with deceptive flu-like symptoms but can rapidly progress to acute respiratory distress. Public health records indicate that HPS has a high mortality rate, often cited around 38%, making it one of the most lethal zoonotic diseases monitored by the Centers for Disease Control and Prevention. The geographic spread of the virus is not limited to a single region, though it is most frequently identified in the western and southwestern United States, where the reservoir species thrive. However, as human development encroaches further into natural habitats, and as changing climate patterns shift rodent migration and population density, the risk is becoming a nationwide concern for property owners and public health agencies alike. Understanding the gravity of the clean or die mandate requires a clear-headed look at the biology of the virus itself. Hantaviruses are enveloped viruses, meaning they are encased in a lipid membrane that is relatively fragile but can persist in a dried state within a cool, dark environment for several days. The headline warning that a simple dry cloth can serve as a suicide tool is a stark, factual reference to the high probability of infection when a person unknowingly creates an infectious mist of dust. This reporting aims to provide a comprehensive look at the current state of hantavirus surveillance, the clinical reality of the infection, and the precise, science-based protocols required to neutralize this threat without triggering a medical emergency. The infrastructure of hantavirus surveillance involves a complex network of state health departments, the CDC, and specialized diagnostic laboratories capable of handling biosafety level 3 pathogens. When a suspected case of Hantavirus pulmonary syndrome is identified, the clinical timeline is typically narrow, leaving little room for error in diagnostic reporting. Patients usually present with fever, severe muscle aches, particularly in the large muscle groups of the thighs, hips, and back, and significant fatigue, because these symptoms mirror those of common influenza or even early-stage pneumonia. Labs must rely on specific serologic testing to confirm the presence of hantavirus-specific IgM antibodies or use molecular techniques like polymerase chain reaction or PCR to detect viral RNA in the blood or tissue. Official statements from medical centers emphasize that there is currently no specific cure, antiviral treatment, or vaccine for hantavirus infection in the United States. Instead, clinical management is strictly supportive, often requiring intensive care unit admission and mechanical ventilation or extracorporeal membrane oxygenation, known as ECMO, to circulate and oxygenate the blood when the lungs fail. This lack of a direct medical intervention places the burdens of safety entirely on environmental control and laboratory-confirmed prevention strategies. Beyond the clinical setting, public health reporting also tracks the prevalence of the virus in the wild. Field biologists and zoonotic specialists conduct periodic trapping and testing of rodent populations to estimate the seroprevalence, or the percentage of rodents carrying the virus in a given area. These data points are crucial for local governments to issue timely travel and housing advisories. Regions where high viral loads are detected in the rodent population, agencies shift their focus toward logistics and trade, ensuring that professional cleaning services, construction workers, and pest control operators are strictly adhering to Occupational Safety and Health Administration guidelines. These guidelines mandate the use of high-efficiency particulate air, or HEPA, filtered respirators and protective clothing when entering confined spaces like crawl spaces, attics, or storage sheds where rodent activity is evident. The contrast between claims of a simple cleanup and the verified biological risk is sharp. Medical experts argue that the time between exposure and the onset of respiratory failure can be as short as a few days, leaving no room for the delays inherent in traditional diagnostic pathways. Consequently, the focus remains on the point of contact between the human and the contaminated dust, where the decisions made in the first few minutes of a cleaning project determine the clinical outcome. Prevention of hantavirus infection is grounded in the total rejection of dry cleaning methods in favor of rigorous wet disinfection protocols. Public health guidance, as established by the CDC and international health organizations, dictates that anyone encountering rodent droppings or nesting materials must first saturate the area with a disinfectant. A common and highly effective solution is a mixture of 1 part household bleach to 9 parts water. By thoroughly wetting the contaminated area and allowing it to soak for at least 5 minutes, the virus is chemically inactivated and, perhaps more importantly, the material is weighed down so that it cannot become airborne. Only after this soaking period should the material be wiped up using paper towels or a wet mop, which must then be disposed of in a sealed plastic bag. Public health officials remain firm: never sweep or vacuum rodent-infested areas, as these actions are the primary drivers of aerosolization. For long-term prevention, the focus shifts to rodent-proofing the home, a process of logistics and structural integrity. This involves sealing any gaps or holes larger than a quarter inch with wire mesh or metal flashing, as mice can squeeze through incredibly small openings. Additionally, eliminating food sources by storing grain, pet food, and trash in rodent-proof containers reduces the likelihood of an infestation. While the science of transmission is well understood, there remain honest limits to current knowledge, particularly regarding the long-term environmental persistence of the virus in various humidity levels and the potential for rare human-to-human transmission, which has been documented with the Andes virus strain in South America, but not yet with the Sin nombre strain common in the United States. Surveillance continues to evolve as researchers look for patterns in trophic cascades, where heavy rainfall leads to increased plant growth, which in turn leads to a surge in the rodent population and a subsequent spike in human cases months later. As we navigate these public health challenges, the most effective tool remains informed caution and the strict application of wet cleaning techniques. By treating every dry, dusty corner of a rural structure as a potential biohazard, individuals can effectively eliminate the risk of a fatal encounter with this hidden pathogen. This report highlights the necessity of following official public health directives to ensure that home maintenance remains a task of improvement rather than an accidental tragedy. For more updates on emerging public health reports and global virus surveillance, consider subscribing to this channel. The institutional response to hantavirus threats involves a highly coordinated surveillance network that links local municipal health inspectors with state-level diagnostic laboratories and the Centers for Disease Control and Prevention. When a suspected case of Hantavirus Pulmonary Syndrome is identified, the diagnostic window is critically narrow. Clinical labs prioritize the detection of specific viral markers, typically utilizing enzyme-linked immunosorbent assays to identify IgM antibodies, which indicate a recent or active infection, or polymerase chain reaction, commonly known as PCR, to isolate viral RNA directly from blood or lung tissue samples. Because hantaviruses are categorized as high-consequence pathogens, confirmed samples are often handled within biosafety level 3 facilities, where rigorous containment protocols prevent accidental lab exposure. This level of security is necessitated by the virus's high mortality rate, which health officials consistently report at approximately 38% for the pulmonary variant common in North America. The logistical challenge for public health agencies lies in the fact that early symptoms including fever, severe myalgia in the large muscle groups, and fatigue are nearly indistinguishable from common seasonal influenza. This diagnostic ambiguity often results in patients being sent home during the initial prodromal phase, only to return days later in acute respiratory distress. The warning that a dry cloth acts as a suicide tool is grounded in the specific physics of viral aerosolization. According to virologists and environmental health experts, the hantavirus is primarily stable in a dried state within rodent excreta. When a resident uses a broom, vacuum, or dry rag to clear away dust containing these materials, The physical friction breaks the dried waste into microscopic particles that remain suspended in the air for extended periods. Once airborne, these particles are easily inhaled, allowing the virus to bypass the upper respiratory tract and settle deep within the alveolar sacs of the lungs. This mechanism of transmission is what elevates a routine household chore into a life-threatening event. Reports from environmental health agencies emphasize that the viral load in a single contaminated shed or crawl space can be sufficient to infect multiple people simultaneously if the dust is disturbed without proper wetting agents. Surveillance of rodent populations, particularly the deer mouse or Paromyscus maniculatus, shows that while the rodents themselves are asymptomatic carriers, the prevalence of the virus within a local population can spike following specific environmental triggers, such as mild winters or increased rainfall that bolsters food supplies. In the clinical setting, the core developments in hantavirus management have shifted toward aggressive supportive care, as there is currently no FDA-approved antiviral medication specifically targeting the virus. When a patient progresses to the leakage phase of the illness, the capillaries in the lungs begin to fail, flooding the air sacs with fluid. At this stage, hospitals must deploy advanced life support measures. This includes the use of mechanical ventilators and, in the most severe cases, extracorporeal membrane oxygenation or ECMO. ECMO acts as an external heart and lung, pumping blood out of the body, oxygenating it, and returning it to the patient to allow the lungs to rest. However, access to ECMO is limited to major tertiary care centers, creating a significant logistical hurdle for patients in rural areas where hantavirus exposure is most frequent. Official statements from medical boards stress that the time between the onset of shortness of breath and potential death can be as short as a few hours, reinforcing the clean or die narrative as a matter of biological reality rather than hyperbole. Furthermore, the intersection of trade and public health becomes apparent in the regulation of professional cleaning and restoration services. Occupational safety standards now mandate that workers entering high-risk environments, such as foreclosed properties, seasonal cabins, or agricultural storage units, utilize specialized personal protective equipment. This includes non-porous coveralls, gloves, and, most crucially, N95 or P100 respirators equipped with high-efficiency particulate air filters. Shipping and logistics firms are also briefed on these risks when handling goods stored in rural warehouses where rodent ingress is a possibility. Public health officials contrast the simple dry cloth claim with these industrial-grade requirements to illustrate the massive gap between common cleaning habits and the protocols required to safely neutralize a zoonotic threat. The lack of a vaccine further complicates the public health landscape. Leaving source reduction, the elimination of rodent habitats and the strict adherence to wet cleaning methods as the only verified defense against a virus that continues to be a primary focus of global infectious disease surveillance. The transition from understanding the biological threat of hantavirus to implementing effective household prevention requires a total shift in domestic cleaning philosophy. Public health agencies are unanimous in their primary directive: the complete abandonment of dry cleaning methods in any space where rodent activity is suspected. The practical application of this wet cleaning protocol begins with the preparation of a disinfectant solution, typically a mixture of 1 part household bleach to 9 parts water. This 10% bleach solution is critical because it achieves 2 simultaneous goals. First, it acts as a chemical decontaminant, breaking down the lipid envelope of the hantavirus and rendering the particles inactive. Second, the liquid serves as a physical binding agent. By thoroughly saturating dried droppings, urine, and nesting materials, the moisture increases the mass of the dust particles, preventing them from becoming buoyant and entering the air as infectious aerosols. Officials state that the contaminated area must remain completely soaked for at least 5 minutes before any physical removal begins. This dwell time is essential for the chemical reaction to complete. Once the material is fully saturated, it should be wiped up using paper towels or disposable cloths rather than reusable sponges or mops, which could harbor residual viral traces. All cleaning materials, including the gloves used during the process, must be double-bagged in plastic and disposed of in outdoor trash receptacles immediately, beyond the immediate cleanup. Long-term public health guidance focuses on exclusion and source reduction to prevent the return of rodent reservoirs. Homeowners are advised to conduct a rigorous structural audit of their properties, looking for any opening larger than 1/4 of an inch, which is roughly the width of a standard pencil. Because mice can compress their bodies to fit through remarkably small gaps, these entry points must be sealed using materials that rodents cannot chew through, such as heavy-duty steel wool reinforced with caulking or metal flashing. Expanding foam is often cited as an insufficient deterrent on its own, as rodents can easily gnaw through it. Additionally, the environment surrounding the home must be managed to reduce harborage. This includes keeping grass mowed short, removing wood piles or debris from the immediate perimeter of the foundation, and ensuring that all potential food sources, including pet food, birdseed, and household grains, are stored in thick plastic or metal containers with airtight lids. By removing the three essentials of rodent survival, food, water, and shelter, property owners significantly decrease the statistical probability of a hantavirus encounter. While these practical steps are highly effective, the scientific community maintains a transparent stance on the limits of current knowledge. Surveillance remains a reactive process, often trailing behind the actual movement of rodent populations. For instance, while it is well documented that North American hantavirus strains, such as sin nombre, do not typically spread from person to person, researchers keep a close watch on the Andes virus in South America, which has shown a rare capacity for human-to-human transmission. There is also ongoing study into how long the virus survives in varying environmental conditions. While it is fragile in direct sunlight, it may persist longer in the dark, humid confines of a basement or an insulated wall. Furthermore, the impact of trophic cascades, where heavy seasonal rains lead to a surplus of pinon nuts or seeds, causing a delayed spike in the rodent population, means that the risk level in a specific geography can change from year to year. Public health officials emphasize that clean or die is not a temporary warning but a permanent standard for rural and suburban living. The ethical responsibility of reporting this data is to provide clear, actionable information that empowers the public without inducing panic. Safety is a matter of discipline and the rejection of convenience in favor of proven decontamination science. By adhering to these wet cleaning and exclusion standards, individuals protect not only themselves but their families and communities from a pathogen that leaves no room for error. For further updates on emerging health reporting and global disease surveillance, consider subscribing to this channel.